Good morning, everyone. So, my name is Chris, and I'm an exercise physiologist. Like Tracy said, I have a bachelor's in exercise science and a master's in clinical exercise physiology. I've been in the health and fitness space for around 5 years now, and since 2022, I've been a practicing accredited exercise physiologist. Since my time in the industry, I've worked with a range of different populations, including semi professional athletes, elderly, children, and adults. And more recently, as an exercise physiologist, I deliver evidence based exercise prescription to a wide range of different populations with different health conditions and or injuries. So I've always been interested with the science behind exercise, and more recently in my practice I've been combining low carbohydrate approaches with exercise, and the benefits of the combination has been profound, and in some cases it's been life changing for some patients. So today I want to talk about what is an exercise physiologist, just to clear that up. Many people don't know what exactly we do. I want to speak about the link, which is going to be the bulk of the talk, the link of the muscle and the brain. I want to speak about the benefits of exercise, specifically on the brain, with focus on mental health and dementia. I want to touch on BDNF and lactate, which are important myokines. And I want to speak about what type of exercise is important and how much of it. And I want to start with the quote: the body should be treated rigorously, that it may not be disobedient to the mind, which is a quote by Seneca. And I hope that that quote makes a little bit more sense to you after this talk. So, to start, what is an exercise physiologist? So, we are university qualified allied health professionals, and we have the knowledge, skills, and competencies to prescribe safe and effective exercise interventions to people with a range of different health conditions, injuries, or disabilities. We are the most qualified, I guess, allied health profession to design safe, effective, and personalized exercise programs for the individual based on their circumstances, based on their health conditions. Okay, so chronic non communicable diseases, or NCDs, are the world's leading cause of death and disease around the world. And in Australia, some of these include cardiovascular disease, chronic pulmonary disease, diabetes, cancer, as well as dementia and mental health, which is what we're going to focus on today. The important thing across what we see across these health conditions is poor muscle quality. Now, poor muscle quality can be a contributor to disease or can be a consequence of disease. So, many years ago, muscle was thought to only be for structure, protection, support, and movement. But now we're starting to understand the more complex role of muscle tissue. Muscle is one of the largest organs in the human body, and it's now considered an organ because muscle contraction causes the release of hundreds, possibly thousands of different microscopic hormones and chemicals, which are known as myokines. Now, these myokines can travel into the blood and travel to different organs and areas in the body, improving those and benefiting those areas in the body. Now, why is muscle so important? So, like I stated, muscle is our largest organ. It produces these microscopic chemicals and hormones. And these myokines, when we exercise and contract muscle tissue, they're released into the blood and they travel to different areas, different organs, the brain, the heart, and improve different systems in the body. So, these myokines, they have the power to combat inflammation, improve the immune system, improve the cardiovascular system, increase your life, and improve your overall health and well-being. So your muscles, which are your largest organ, have this important capacity to release these important chemicals into the body. Now, when we diminish muscle mass and quality, we can dysregulate the hormones that the muscle releases. Now, this dysregulation can cause or worsen health conditions. Now, I have this photo up here to show you that exercise is not just for burning calories. Exercise and muscle contraction causes the release of hundreds, possibly thousands of these myokines. And these send different signals to different parts of the body. No medication or diet can elicit the release and benefit of these myokines. So the muscle system can be seen as a system which basically communicates with all the other organs and systems in the body and can unify whole body health. So next time you're contemplating whether you should exercise or not, stop thinking exercise as something that burns calories and start thinking of exercise and appreciating the role of these myokines which are released from muscle contraction. Now, the only way to unleash these myokines is through exercise. Now, exercise is truly a medicine, and we literally have an amazing pharmacy of these myokines within our muscle tissues, ready to do their job, ready to do their work. Now, many pharmaceutical companies at the moment are trying to put these myokines into a pill, but it's going to be very hard to mimic the function of hundreds, possibly thousands of these myokines. Now, I want to dive into the evidence that highlights the important link and role of muscle, exercise, and their effects as an antidepressant and an anti-dementia medication. So this study, when it comes to physical health, what we often see in the studies is a bidirectional link between metabolic health, physical health, and mental health. So that being said, if we have poor physical health, then we're likely to also have poor mental health and vice versa. Now, this was a large population-based cohort study, which included over 80,000 participants who had neuropsychiatric disorders. It also included over 80,000 control individuals who were healthy and had no neuropsychiatric disorders. And what this study found is poor body health, particularly metabolic, liver, and immune health, was a more marked manifestation of mental health than brain changes itself. So our physical health was a more marked manifestation of what was going on in our mental health. Now, it's important to know that exercise has large, potent benefits on metabolism, on the liver, and on the immune system, and therefore can indirectly improve our mental health and our cognition. Now, let's talk about how exercise can directly improve brain function and mental health. Now, I think my slides are a bit mucked up there. But this next study, titled "The Effectiveness of Physical Activity Interventions for Improving Depression, Anxiety, and Distress." So this was a large 2023 study, including over 90 systematic reviews and over 1,000 randomized controlled trials, looking at over 100,000 participants. So this was a large study, and it found that physical activity had similar or greater effects than medication or psychotherapy for improving depression, anxiety, and distress. Now, the researchers concluded that exercise is very beneficial for improving mental health symptoms and have called exercise to be a mainstay approach when treating mental health conditions. Now, this is not old science. We know there's lots of research highlighting the important role of exercise and its benefit over usual treatments. Unfortunately, when you go and see your regular GP, you're often put on drugs as a first line of treatment. But I believe, and the science also backs, that exercise and lifestyle approaches should be the first line of treatment when it comes to managing mental health conditions. Now, let's switch lanes a little and focus on the studies looking into dementia and Alzheimer's disease. Now, this was a 2022 study which includes over 450,000 participants and looked at dementia incidence and mortality in comparison with hand grip strength. And what it found was that low hand grip strength is associated with a 72% increased risk of dementia. Now, that's a crazy figure, and again, it highlights the link between muscle function and brain health. Now, this next study, titled "Alzheimer's Disease Large-Scale Gene Expression Portrait," identifies exercise as the top theoretical treatment. Now, this study looked at over 250 treatments for Alzheimer's disease and concluded that exercise is the #1 top treatment for Alzheimer's disease and dementia. Again, highlighting the important role which the literature shows that exercise is a very, very important therapy for improving Alzheimer's disease, dementia, and cognition. Now, this study was a randomized controlled trial on 100 participants with mild cognitive impairment. The study included a 6-month progressive high-intensity resistance training protocol and assessed structural brain changes throughout different points of the study. And what the study found is that high-intensity exercise in the form of resistance training improved the area of the brain which is directly implicated and related in dementia. Now, to add, resistance training promoted this protective effect in the brain for up to 12 months after the exercise had stopped. So we've still seen this effect when the participants stopped exercise. There was still a beneficial effect on the brain, particularly the area directly related to dementia. So again, highlighting that important role of resistance training, and in this case, high intensity resistance training for brain health and cognitive function. Now, this graph, I can notice my slides are a bit stuffed up there, but this graph highlights the physical and cognitive function of resistance trained versus recreationally active versus sedentary individuals across the lifespan. Now, I wish you could see this better, or I hope you can see this better on your end, but the study points to a difference in those who are recreationally active and those who are resistance trained. We know resistance trained individuals generally have good cognitive function and are physically independent at their older ages, whereas recreationally active individuals may be left with mild cognitive impairment with limited mobility. Those who are sedentary are the ones who usually end up with dementia, cognitively impaired, and dependent on others to complete day-to-day tasks. So bottom line, to optimize your longevity and your cognition, resistance training is a very important tool and a very important exercise to be doing. Now, again, myokines are these microscopic hormones and chemicals released by muscle tissue when we contract them and use them. So they have different effects on different systems and organs in the body, but today we're going to speak about the specific benefits that these myokines have on the brain. So the benefits of exercise, particularly on the brain, includes improved mental health symptoms and improved cognition. Now, this is due to the increased expression of these myokines, which the muscle releases. And two important myokines include BDNF, which is brain-derived neurotrophic factor, and lactate. Now, myokines have a neuroprotective role in the brain. They improve neurogenesis, which is the growth of new neurons. They improve neuroplasticity, which is how our brain connects and links together, and also improves neurorepair and is an anti-inflammatory for the brain. Now, we also see, like I stated in that randomized controlled trial, we also see improved areas of the brain directly related to dementia. We also get an increase in blood flow to the brain, and this is important for oxygen and nutrient delivery. Another important benefit from exercise for the brain is an improved energy brain metabolism. Now, what we often see in people with dementia and Alzheimer's disease is a reduced uptake of glucose and energy production. Now, when we complete an exercise routine, particularly high intensity exercise, we produce lactate and ketone production. And these can be an alternative energy source for the brain, improving cognition and improving mental health as well. Now, what we also see from exercise is regulation of stress. So regulation of our HPA axis, or our hypothalamic pituitary adrenal axis. Now, with exercise stress, the body learns to better adapt to that stress and better regulate that HPA axis. Now, what studies have also found is that regulation of stress is not only improved from repeated exercise stresses, but it also improves psychosocial stresses, like your everyday stress that we get. So exercise doesn't only improve exercise stress, but it also improves psychosocial stress in everyday life. Now, this study highlights that sarcopenia, which is a loss in muscle mass and strength, which occurs with aging. It's a normal part of the aging process, but it is accelerated by having an unhealthy lifestyle, poor nutrition, and not using your muscles. Now, the study shows that sarcopenia results in a dysregulated myokine release. Now, this dysregulation can cause inflammation in the level of the brain, which can result in cognitive decline and eventually dementia. Again, this study highlights the important link between muscle myokines and brain and cognitive health. Now, this next image highlights, so them arrows are meant to be pointing downwards. So this next image highlights the role of exercise as a neuroprotective medicine. Now, exercise and muscle contraction cause the release of myokines, which can travel into the blood and pass the blood-brain barrier. Now, I wish you could see the image clearer, but basically these myokines can pass the blood-brain barrier and exert neuroprotective effects. So these include things like neurogenesis, which is the growth of new neurons, improving neuroplasticity as well, and decreases neuroinflammation. So there's many important neuroprotective effects that these myokines have. Now, when we dysregulate the myokine release, it can have an inflammatory negative effect on the brain. But when we're using muscle appropriately, when we are exercising, these myokines are released in a healthy manner to really provide these whole body benefits and these cognitive and mental health benefits that we see. Now, BDNF, which is brain-derived neurotrophic factor. So these are one of the well-studied myokines, and it's released from muscle contraction. We also know that lactate also stimulates BDNF in the brain. BDNF is a neuroprotector. It improves neuroplasticity and neurogenesis, acts as an anti-inflammatory, and BDNF is also decreased in people with depression and in people with dementia. And we also know that some SSRI, which is anti-depression medication, increases BDNF, but exercise does this without the side effects. So following acute exercise, there is a temporary increase in BDNF levels, and this rapidly returns to baseline, and researchers believe this is due to reuptake of that BDNF into the brain, and that aids that neuroplasticity and neuroprotective function of BDNF, and to help with cognition, mental health, act as an antidepressant and an anti-dementia myokine. So lactate is another important myokine which is released from contracting muscle into the bloodstream. Lactate is thought to be a waste product, but really it is an energy substrate as well as a signaling myokine. So lactate has similar effects to such as like BDNF does on the brain, improves neurogenesis, is a neuroprotective myokine, and like I said, lactate also stimulates BDNF in the brain, which is also important for improving that cognition and acting as an antidepressant myokine. Now, lactate can also, as I said before, act as an alternative energy source for working muscle and for the brain. Now, like I said, in people with dementia, they cannot use glucose appropriately and cannot uptake glucose and metabolize energy appropriately at the level of the brain. So lactate offers an alternative energy source, but also improves glucose uptake in the brain, improving energy metabolism via glucose. So lactate is not just a waste product. It is an important myokine, and this image can, I guess, give a visual representation showing exercise stimulates lactate, which has these beneficial effects, acting as an antidepressant and an anti-dementia myokine. Now, lactate can also stimulate an increase in blood flow to the brain. And over a longer term of repeated exercise, we see structural improvements in the brain, such as an increase in hippocampal volume, which is again important for that long-term protection. So what type of exercise? Well, an individualized approach is best, but all exercise has some sort of benefit for mental health and for cognitive health. We know optimal prescription should involve high intensity exercise in forms of cardio and resistance exercise. So, what is resistance exercise? Well, resistance exercise, also known as strength training or weight training, is a form of exercise that involves working against an external resistance. So, this might be dumbbells, barbells, weight machines, resistance bands, or even body weight. Now, high intensity resistance training involves performing exercise with a higher level of effort and intensity to stimulate our higher force muscle fibers. Now, this does not mean you have to lift heavy weight. We can take a light weight and complete slow reps to a point of failure, which also stimulate these high force muscle fibers. We know that studies have shown that moderate intensities have shown similar benefit. However, high intensities do have an added benefit. And low intensity exercise has shown least benefit for improving mental health and improving cognitive function. So why high intensity exercise? Well, the studies show that high intensity exercise causes an immediate increase in brain-derived neurotrophic factor and lactate. So we also see greater improvements in reported symptoms and outcomes in the studies with higher intensity exercise. And going back to this large 2023 study, which had over 100,000 participants, showed that all exercise types were effective, but higher intensity exercise was associated with greater improvements in mental health. Again, however, moderate intensity exercise still had some benefit, but it wasn't as optimal as a high intensity protocol. Now, low intensity may actually be insufficient for stimulating the neurological and hormonal changes that are associated with improvements in depression and anxiety. Now, overall, a multimodal approach, so using resistance exercise and cardio in forms of moderate or high intensities, is advised. So how much exercise is needed? Well, not much at all. The studies show that just 6 minutes of all-out cycling increases BDNF, so that important myokine, which is very important as a neuroprotector and improving neurocognition. We know that 6 minutes of all-out cycling increases that myokine. So this study actually looked at fasting for 20 hours, light exercise, so a 90-minute low-intensity cycle, high-intensity exercise in the form of a 6-minute bout of vigorous cycling. And it also looked at a group which combined fasting and exercise. And the study found that brief but vigorous exercise was the most efficient way to increase BDNF compared to lower intensity exercise or fasting. When the researchers combined fasting and exercise, there was no added benefit. So we know that high intensity exercise can increase BDNF by 4 to 5 times more than either fasting, which had no increase, or low intensity exercise, which only had a slight increase in BDNF. So again, we know that one single high intensity exercise session can have immediate benefits. And even just doing one session a week, assuming you're consistent with this one session a week, will have potent benefits on brain health and mental health. But for a more optimal dose, you should include high intensity resistance training at least 1 to 3 times a week. These sessions can be as short as 15 minutes or go for up to 60 minutes. Again, this depends on the person and their circumstances, and it's why an individualized approach is important. Now, high intensity cardio intervals are also beneficial and can be done 1 to 3 times per week, and can be done as short as 5-minute exercise bouts. So very, very time efficient and very effective. And if you're going to implement what I just said, then I don't think moderate intensity exercise is absolutely needed. However, 3 times per week for 30 to 60 minutes of moderate intensity type of cardio has also shown to be beneficial on mental health and cognition. So overall, be active, prioritize the high intensity resistance training and cardio, which won't take too much time out of your life, but make sure you don't sit down for the rest of the day. Be active, take the dog for a walk, use the stairs instead of the escalator, add in a short 5 to 10 minute walk after your meals, because we know that being active will overall improve health and well-being. Now, I cannot stress enough that an individualized approach is optimal. What I've stated is only generalized recommendations. And many people often go into exercise classes or boot camps or CrossFit classes, or start exercise just too much too quick, and often come out with injuries, and this stops them from further exercise participation, and this is not ideal. And this is where we come in as exercise physiologists. We're here to tailor the most effective, safe, and personalized exercise and physical activity prescription for you based on the individual, based on their circumstances, their health conditions, any medications they might be taking, any injuries that they might have, any time constraints, or anything in their lifestyle that may be a barrier to exercise. We work around this to formulate one of the most personalized and optimal exercise routines and physical activity prescription for you. So to conclude, muscle is our largest organ, and exercise is not just for burning calories. Instead, we exercise and contract our muscle tissue to release beneficial hormones, which can improve mental health and brain function. Again, all exercise has some sort of benefit on cognition, on mental health, but we know that resistance training, particularly high intensity, seems to be the most potent. Now, if you want to learn more about exercise physiology services, please scan the code that you see on the screen or take a photo of the slide and reach out. And you can also see me face-to-face in Girraween. And I also work alongside Sydney low-carb specialists, providing efficient, effective, personalized exercise programs for anyone with chronic diseases or injuries. We're here to, improve exercise participation and hopefully improve your life and improve your well-being. So that being said, thank you everyone for listening. Again, I'd like to thank everyone for your attention, and any questions I'm happy to answer as well. Thank you.
Awesome. That was great, Chris. Thank you. Thank you so much. We have got a few questions that have come through, but I'm going to ask you my questions first because we've got a bit of time to chat now, which is great. One of the things I think I've seen, so I was a personal trainer, which, you clarify, it's very much not what you are. I'm an exercise physiologist, is very different to a personal trainer. Yeah. So I think, your job is so, so important. And when I came into the low carb space about 10 years ago, there was such a, people discovered, I suppose, that you could lose weight with just diet, and you didn't have to exercise. And there's such a myth in the low carb space that, I can lose weight with just diet, I don't need to worry about exercise. But I think what you've shown so clearly is, well, we think exercise is just for weight loss. It's not even what it's for. And look at the benefit for your brain. I mean, that is phenomenal.
Yeah, it is amazing. It's amazing. And that's why I like to tell people to stop thinking of it as a calorie burner and start thinking of it as to release these potent myokines that have not just these effects on the brain, but all our other organs as well, the liver, the pancreas, the heart.
Everything. And it's that getting out of that mindset of, which is, we're still shoved in our face, that just eat everything, eat shit, everything in moderation, but just, you can run it off. It's just, I think that has made exercise in so many people's minds out to be just this horrible, long, sweaty, have to go to the gym. It doesn't have to be like that at all.
That's right. Yeah. It can be, it doesn't have to take all the time out of your life either. It can be, time efficient, and it can be effective.
Yeah, I love how you say that, because I used to do a lot of long distance running. I don't do that anymore, but I do the high intensity resistance training in the mornings. I get it done. Like I've got a bit of a cold, so I haven't been in the ice bath this morning, but I would go in normally and then hop out and do, literally 10 minutes.
Yep. And it has all the benefit.
Yeah, it's amazing. but incorporating, well, as you said, just moving as much as you can during the day,
It's also
because
very important.
mm,
You don't want to do that 10 to 15 minute session, which yes has these potent benefits, and then just sit on the lounge all day. You want to
really,
incorporate you want to incorporate you want to incorporate different types of movement throughout the day. So like a 5 to 10 minute brisk walk after meals, or just to break up sitting time, taking the stairs, taking the dog for a walk, taking the kids out to the park on the weekend, that sort of thing. Just overall being active, I think, is also very important. And that's not to negate any of the benefits of low intensity cardio type exercise. There are benefits, but when we're talking particularly for the brain, well, we're seeing in the science that those high intensities offer much more benefit and potency.
Yeah, it's like sleep. We have to consciously, you know, go against what. I can hear something. Can you hear anything in the background? Is that
No, I'm not getting any
no?
feedback.
You're not good. You're not getting feedback. Good, just me then. We have to consciously go against our modern world, really, because we're designed now to sit all the time. Everything is easy. There's elevators everywhere. Remote controls. So we just have to be aware. And the
Yeah.
more we are aware with, the more we can, do all those things that you suggest. So I've got a couple of questions that I'd like to put. So that are around the diet side of things. So obviously your work with low carb, Sydney low carb, is low carb. I want to know, first of all, where does diet fit for you? And is that something that you would help people with that come to see you as well?
So the good thing with that, working alongside Sydney low carb specialists, is that a lot of their clients and patients already have that knowledge, which has been given by the dietitian or the doctors. So it's really good to have. It's really relieving to have that, I guess, added support from these other practitioners to be able to give this low carb advice. And I'm a very big proponent of a low carb lifestyle, particularly in combination with exercise. And many people think, particularly for resistance training, that we need to be having carbs to be able to, to give you energy to complete those, resistance training and high intensity exercise routines. But we know that, the liver can, provide all the demands of sugar and glucose for the body to be able to do these different tasks and do these different exercise types. So yeah, I'm a big proponent of low carb, and the combination and combining the effects of exercise and low carb for insulin sensitivity, for glucose control, for fat loss, for metabolic health has really been phenomenal to see in patients, that the benefit that has.
Can I ask you how you sort of discovered, low carb? Because obviously mostly in the exercise world, it's high carb.
Yeah. Well, I had family members who suffered with diabetes, type 2 diabetes, and I wanted to help them out. So this was when I was a personal trainer, hadn't had my exercise physiology, I hadn't finished yet. And I wanted to help them out. So I started looking into more of the research side of things and, seeing what's out there. And I guess the research, brought me across the low carb lifestyle type of, approach. And then I applied that, to these family members, and it showed to be so potent, and it works so great, like fat loss, reversing pre-diabetes. So yeah, I was like, okay, I'm onto something. Am I the only person that knows about this or something? And then looked into that further, and it was lovely to find other practitioners who have that same belief, because it's very hard to find other GPs and other dietitians who have that low carb belief and low carb approach.
Absolutely, absolutely. So there's one question come through here: that can strength training bring on vertigo attacks on someone on a low carb diet?
It can, if you're not breathing properly through your repetitions. So when you exhale, when you're doing a bench press, for example, on the way down, you want to breathe in, and on the push phase, you want to breathe out. So you want to make sure your breathing is good, because firstly, that can obviously have that vertigo effect. If we're holding our breath, we can increase intra-abdominal pressure, and that can cause that effect. Another thing is, if we're laying down and we get up too quick, we can also have that effect of vertigo. So I guess it's just being mindful of how quick you get up and down from like a leg press, for example, or from a chest press. But big one is to make sure you're breathing properly through your workout and through your reps and sets.
And I guess that's really irrespective of diet. But I suppose on a low carb diet, we generally have like our, if we're, maybe we need to increase our salts a bit more. That's one thing I see a lot. People don't
Yes,
have.
Yep, that's a big one as well. Electrolytes and increasing sodium is very important, because I educate that to my clients, that when you're on a keto or a low carb diet, you're going to lose more of those electrolytes, especially when we're exercising. Exercise uses electrolytes. We need to replenish those. So that's another important one for vertigo. Yes.
And so
another one I'd like to add, sorry, Tracy, is what we often also see is blood pressure reductions when we start an exercise routine, and particularly those who are combining, low blood pressure medication with exercise. We often see that combination effect causing large droppages. That can also cause like dizziness and vertigo-like symptoms as well. So maybe checking out your blood pressure and having a look at your dosages with your GP, of course, would be beneficial.
Yeah, absolutely. In terms of long distance running, marathon and half marathon, do you see any benefits in consuming carbohydrates? I suppose so. During the race, I assume I know this person that's asked this question is already fat adapted, so they probably
Look, the science isn't concrete yet, but I think that if you are fat adapted and you're adding in carbohydrates, small doses, as an ergogenic aid, as a performance aid on the day of the race, or some carbohydrates the day before the race, I think that will hold extra benefit, because when you do that race, you're still going to be burning your fats. It's when you get to those higher intensities or towards the end of the race, you're going to start using more of that glucose, that carbohydrate. So I think everyone would have, it'd be very hard to say how much, because everyone has an individualized, how much of carbohydrates will increase in their performance. But, generally the carb loading, is way too high. So we know that something lower is more beneficial. Again, we don't have as much GI stress, gastrointestinal stress from higher amounts. But to answer your question, I do think it have some sort of ergogenic aid, having small amounts of carbohydrates if you're already fat adapted.
Yeah. And obviously that's something that you have to play around with, because,
it's very much trial and error. Yes.
Yeah.
There's not much, like, there's science out there, but there's not much showing, different grams of different carbohydrates and giving concrete evidence on what is optimal. So it is an individualized approach.
Yeah. I did see in one of the slides that you showed that there was, in a study that showed there wasn't much difference in, I think you were talking about the BDNF then, in terms of fasted training and non.
Yep.
So what's your view on fasted training? Is it better? Does it matter?
Look, I am a fan of it because it does increase fat loss, and it can really increase fat burning rates after the exercise session is done. But that being said, if you do have an empty stomach and you don't perform well on an empty stomach, then it's going to impede your exercise performance, right? And we're not going to get, the biggest bang for our buck for exercise either. So I think it's important to have maybe a protein meal if you do feel weak on an empty stomach. However, I don't think it's a negative to train in a fasted state. I do think it has its positives, particularly if you're adapted to training in that state.
Okay.
But when we're not adapted and when we may feel weak on an empty stomach, I think, that can impede performance. So in that case, you do want to, even like a whey protein shake or something, if you're on a low carb, journey, you want to have something high protein, low carb, stick to that, because that, again, having something high protein but low in carb doesn't affect the fat burning rates of that exercise session, right? What we do see is carbohydrate ingestion before exercise decreases fat burning rates during and after that exercise session. So therefore, if you're trying to lose fat, having carbohydrates around your exercise session is going to be counterintuitive. So we want to have either a protein meal, or fasted is also good.
And obviously, I mean, I guess that's individual too, because I was a personal trainer, as I said, and that was years ago, 15 years ago now, and it was all, have your banana and have your yogurt and all that stuff before you trained.
Yep.
But I personally haven't trained. I haven't trained and haven't eaten before for years. But I did see something the other day about the potential of. I think the body kind of just does get really comfortable too. So it's probably good to just change things around sometimes and experiment.
Yep.
It was just something around, and I don't know. I'd actually now it's come to me. It was someone who I really rate, and I can't remember who it was, but he posted about how if you're always training fasted and you're finding that your muscle, like your physique isn't changing, so you're not losing fat and gaining muscle, consider eating prior to it. What's your thoughts on that?
Well, the biggest thing that we see in people who are fasting, if they're fasting and they're not getting adequate amounts of protein in, fasting is fine so long you're getting that protein in. Now, when people start to get inadequate amount of protein in due to a fast, because it's really hard to eat that much protein in one meal, then you can start to, see your recovery rates start to become slower. You start to see your muscle pain sticking around for longer after exercise sessions, and you can start to get into an overtraining phase, because we're not giving the body enough protein, enough of that building block. So I would say, with fasting, you definitely need to look at, are you having enough protein in the day? Because that's definitely going to affect the benefits of exercise. Exercise is there to stimulate, adaptations, but we need the recovery, we need the building blocks, which is going to come through protein and electrolytes.
Yeah. And in your view, it is really, as long as you get it in overall, what's your view on the window? Is that a myth?
Yeah, that is a myth, and it's been shown to be a myth. We now know that, if you have one meal per day, so long that meal hits your protein targets, then you're gonna be good. If you're not hitting those protein targets, you're going to be in trouble. And that can be like, I have patients who might not lose weight because they're not eating enough protein, and that impedes recovery. And it's a vicious cycle. So you want to get that protein in to be able to get the proper recovery rates, building blocks, to be able to recover from that exercise session. So I do think protein is very, very, very important when it comes to an exercise routine. Otherwise, we could just beat ourselves into the ground, feel tired when we're not getting that building block in, feel overtrained. We really want to get that protein in. It is very important.
Actually, on overtraining, what are the signs of overtraining?
Yep. So tiredness and fatigue is a big one. Not losing weight is a big one on a longer term. Being sore for too long and that's a sign of, that's a big sign of overtraining. When we're sore for too long, our body's not recovering quick enough. That's probably your biggest sign. But yeah, your two biggest would be fatigue and soreness levels, which are just going on for too long.
Yeah, I think that's what, one of the things I see a lot is that we don't really understand that the body needs to rest to actually get all the benefits of what we're doing.
Yeah, that's right.
Trying to explain that a little bit. So it's obviously that breakdown, we're damaging the muscle, and then the rest is where the magic happens.
That's right. Yes, we cause the stimulation during exercise to cause these good effects. But yes, that's right. Where we rest, the recovery is where all the good things happen. In sleep, that's where all the rebuilding effects happen. So yes, that 15-minute high intensity session is important. But what you do in the rest of your time of the day is even more important to stimulate these benefits and keep them going. Yeah. So definitely what you're doing outside of the gym or outside of your workout is 100% very important for your long-term success with that exercise routine.
Yeah. So there's a couple of comments around excuse me. Sorry, around I broke everyone's ears. About body pump, and they love the repetition and the high intensity.
Body pump, you said?
Yes.
Yeah.
So that's obviously a good form of exercise.
It is. The only problem is with body pump is I believe that it's in a class environment, and I like class environment because it gets people exercising more. But if you're not up to that capacity, or if you can't do what everyone else in the class is doing, and you're really trying to push yourself to do what they're doing, people do come out with injuries like that, and then that can stop them from long-term exercise participation. So I love body pump and the way, you know, they do things, but when it's in a class environment, I'm not a fan of it. If that makes
Okay,
sense.
that's interesting. So how would that compare to like marathons or long distance training? Do you think that sometimes that the damage might outweigh the benefits of
Of
that type
long
of training? Yeah,
of
long
long
distance.
distance, so we do see in science that, you know, people who are only endurance trained, they can come out with different cardiovascular problems like cardiac myopathies and things like that due to the large volume of exercise over their lifetime. So that it can in some cases can be counterintuitive due to it makes the heart grow too much and can cause problems. But that being said, generally you're not going to be in any harm.
Yeah, yeah.
But we do see
Awesome.
that.
Yeah, I mean, yeah, I've seen it. I've seen it too. I think it becomes sometimes a good addiction, maybe. Is that such a thing? But you know, that just that having to, you know, I suppose it is a stress relief in some way. So
Yeah,
that distance and people
people
can
get into
maybe,
Zen,
yeah. I
into a
used to be
Zen
like,
mode.
yeah, it definitely used to be me. I used to be like that. Used to be my escape when my kids were really little. I would just
Yeah,
go out and, you know, no one could talk to me. No one, you know.
and
I don't
and,
know.
and there's nothing necessarily like wrong with long endurance type of exercise, but with the patients and clients that I deal with, you know, if I send them on a long endurance run or a long endurance cycle, they're likely to come out with some sort of injury after that, and it's going to, you know, stop them from further exercise again. And the
Mm,
interesting thing with that is people generally think like cardio type exercise, like running, has less injury risk than strength training. And in fact, that's actually wrong. If we're strength training with controlled repetitions, with appropriate weight, your risk for injury is very, very low. Whereas if we're going for a run and if we're doing that run incorrectly with incorrect technique, or we may be a little bit overweight, sending incorrect force down those joints, you're going to run into some problems, into some injuries. And again, it's going to stop your participation of exercise. And that's what we don't want, right?
mm, mm, exactly. So yeah, just lots of other comments, but I want to finish it with a comment or my question around how, because it's one I get all the time. How do people start? Is it ever too late? Like, you know, and where is the best place to start incorporating more of this, you know, beneficial exercise in our day?
Yeah, it's never too late. The science shows that, you know, even the elderly can get benefits from exercise, can get muscle quality improvements. So it's never too late. Now, where to start? I would start with visiting an exercise physiologist to get a personalized exercise program. That's number one, because getting that personalized approach will lead you into long-term exercise adherence. And that's the most important thing. But if you're going to start, I would start with a whole body resistance training program 2 to 3 times per week. That can take 15 to 30 minutes. And as long as you're guided by a professional, it's going to be safe, it's going to be very effective, and it's going to be very time efficient. So I would
Mm,
start with employing resistance training, ideally prescribed by a professional, and going down that route.
yeah, yeah. Sounds like great advice. So any final tips to finish? This is comments, but no other real questions, just lots of
Yep.
comments. And it's been such a great presentation, Chris. It's been really, really great to meet you and, you know, just hear about all that stuff around the brain. And as I said, it
Yeah.
just people just undervalue, you know, how
Yeah.
much it does to us because we still think it's about weight loss and it's about
That's right.
so
Yeah.
much more than
Yeah.
that. So
Weight loss and muscle gain are just side effects of exercise.
I love it. I love it. So final tips.
Yeah, final tips is just make sure you move more in your daily life. Involve some resistance training into your life because it's going to go a long way for all your organs in your body and all your systems in the body. So if you need to, reach out to someone to help you with that. Move more and get in. Post meal walking is also very important because post meal walking can really direct all that energy substrate towards the working muscles rather than towards the abdomen where we don't want it.
Awesome.
And thank you so much, Tracy, for, you know, allowing me to present as well. It's
Yeah,
been good.
awesome. It's
And
been such
apologies
a
for
long.
my slides were a little
Your
bit stuffed
slides were
around there.
fine.
Were
They
they? Did
did.
they look fine? Oh, right.
They looked fine. They looked
On
fine to
my
me.
on my end, they looked all blurry and stuff. That's why I was like, oh,
Oh no, not at
yeah.
all. Not at all from
Okay,
my
perfect.
end anyway. So,
Amazing.
but if anyone wants copies of them, they can reach out and we can send them.
Yeah.
But no, it looked totally fine from my end. I think you
Okay,
did an
perfect.
awesome job, and it was great to meet you, Chris. And hopefully, I'll meet you
Thank you,
face to
Tracy.
face sometime
Hopefully
in
sometime
Sydney.
soon.
Yeah. All right.
Amazing.
Thanks.
Thank you. Thank
Bye.
you. Bye bye.
Bye.